I'm Dr. Blake Butler, and I'm a functional medicine provider with Align Modern Health. And today we're going to discuss finding the right diet for you as an individual. This is a really good question because there's not a one-size-fits-all approach from a dietary standpoint, and dietary trends seem to come and go. So it's very confusing when looking on the internet and trying to establish the appropriate diet based on what worked for someone else. Additionally, we have to establish sustainable eating patterns because the research shows over and over again that diets don't work long-term. So our job is to find something sustainable based on individuals' chemistry and their gut microbiome and their environment. And we do that with the appropriate testing because our goal is not to create a restricted eating pattern. Our goal is to create a sustainable eating pattern. Most often, I recommend looking at blood sugar trends via blood testing. In addition to that, I like to look at hormone patterns, specifically thyroid hormone patterns, because it's very common to see suboptimal thyroid hormone regulation, which impacts our metabolism. And there's dietary strategies that we can use to help support thyroid function by introducing foods rich in certain nutrients like selenium and zinc. Furthermore, we can establish appropriate dietary modification to balance blood sugar, energy, and our metabolism, which impacts our ability to regulate and maintain a healthy weight. And understand that a healthy weight looks different on all of us, but our job is to establish the appropriate trends based on evidence as opposed to trying to pick and choose the diet of the month. With functional medicine, we have the opportunity to partner with registered dietitians and clinical nutritionists to work with individuals to create a plan that works well for them. Everyone's lifestyle is different, everyone's needs are different, so our goal is to meet individuals where they're at to establish sustainable practices from a dietary perspective. My primary goal is to focus on inclusion because foods are healing, and I think it's really important to allow foods in the diet to help regulate our overall health and well-being. But in some cases, we do have to make further adjustments based on advanced testing, and that's our job. We want to make sure that we're doing that appropriately and doing that on an individual basis because no one should entirely avoid a certain food category unless there's a specific reason. And it's very common that we find that reason when looking at this from a functional medicine lens.